For women of childbearing age and pregnant women and guardians of young children, in a place like Malawi, there are a lot of barriers to them to accessing health care. One of those is that they may be far from the health centers. The health centers are going to be overcrowded and understaffed. And so for them to have access to information at any time to help them decide whether they should seek care or whether it's something that they can take care of at home is incredibly important.
Hello? Yeah,
This pilot project, the Information Communication Technology for Maternal and Child Health, encompasses a couple different ways that we can use communication technology. First would be the hotline, which is part of what we call Chipatala foni, which means health center by phone in Chichewa.
Hello.
The hotline is a service that's run from 7 a.m. to 7 p.m. Anyone can call for free to the hotline and receive information about their pregnancy or about taking care of their under 5 child. The registration process is actually built off of Baobab Health Trust system of registration that's being used in several different health centers. So a caller to the hotline gets registered into the system, the same system that they would if they went to a health center that had the Baobab system.
So, Doreen, just tell us what that call was about.
The call is he's calling a pregnant woman she wants to register.
So this was her first time?
Yes. She registered and I was advising her on nutrition food, and she can go to antenatal clinic and sleep under mosquito net to protect malaria.
The training that they received was very much the same training that an HSA, a health surveillance assistant, would receive for maternal and newborn health and for the integrated management of childhood illnesses, IMCI. Then we also, of course, added our hotline-specific training based on the understanding the Baobab system, as well as some skills on customer service and how to help people feel comfortable sharing their information on the phone.
This is a quality circle. In its essence, it's a gathering of health workers in an...
because we have 2 categories. One is for the pregnant women and children. For the children, normally it's about the symptoms, say maybe cough, vomiting, fever. We take fever or cough after 7 days, it becomes a danger sign, and diarrhea, when it goes up to 21 days, it's a danger sign. So if one has got diarrhea for 21 days, that is a danger sign. We refer that one to the health facility. But if it is less than maybe 3 days, then we just advise them what to do or to meet the village clinic.
The hotline worker suspected pneumonia and referred me to the hospital. It was pneumonia.
When she had a problem with the legs and the abdominal pains, and also when she lost her appetite, she also called Chipatala foni, and she was advised on how best to control that problem.
She was losing water from the uterus, so it was a danger sign for a pregnant woman. So the hotline nurse told her that immediately she should go to a health facility. So she started off to Balaka District Hospital, where she was assisted. That same night she gave birth.
Something like 30% of the community have a phone in the home, and another 30% on top of that may have access to a phone. But since this is a phone-based intervention, we wanted to be sure there were more phones. And so one way we're doing that is putting community phones into these communities. We've identified community volunteers, 1 per village for each of the 4 catchment areas. That amounts to a lot. It amounts to something almost 400 volunteers. And these volunteers, in addition to being our mobilizers, in addition to being our sensitizers to help community members know about the service, they also hold a phone, a community phone.
I encourage people to use the service and provide them with the phone. When they have a problem, they can find me and use the phone to call the service and get advice.
So what is happening here is that Mr. Bula, who is the volunteer, came here to help the mother of the twins to register her two twins, because I think she doesn't have a phone of her own.
I go through the community and find women who are pregnant and give them the information. Most women are open to the idea, very few don't take part. The project staff and some people from the hospital came and asked me to help. I helped them to find volunteers and to get the support of the village headmen. When I'm heading up a village meeting here, I speak to the people about Chipatala foni, and I also allow the community volunteer to talk about the project.
The second part of Chipatala foni is the tips and reminder service. And this is where pregnant women or caretakers of children under 1 can receive text messages or SMS messages each week according to their week of their pregnancy or the week of the child's age. So they're very targeted toward them with general health information about prevention, about danger signs, things that they should look out for, nutrition. There's a big nutrition component as well.
She got a message telling her about nutrition. Should at least try to have food from the 6 groups of food, like milk, ants, grasshoppers, that falls in the group of proteins.
I've been getting messages during my pregnancy. One of them was about nutrition and getting enough from the 6 groups of food, and also about starting ANC visits as early as possible. I didn't know before this about what pregnant mothers needed, like the nutritious foods, and also that they need time to rest from work.
It's an important part of the innovations process that we are testing new ideas. So our expectation is that some things will work and some things won't work, and that what we'd like to do is have rigorous research that shows what does work and whether it can be used in other contexts. What we've shown through this project here is that certainly we can increase that access to information for women. We can make sure that they can make better decisions based on the information they get through a hotline and a tips and reminders service.
We started with the basic model that we're having a hotline, and we've seen that evolve, and we've had some very direct feedback that people are appreciating that service. They like the contact time, they like the direct advice, they like the confidentiality of it. The messaging service has also evolved. We've added some extra information into that, again based on particular issues that we've seen have become important that perhaps we didn't include at the start. So for example, we've added some family planning information into the tips and reminders.
We discovered that we are not reaching a lot of pregnant women in early pregnancy, so we had to re-strategize by adding another service like women of childbearing age, so that people should get used to the service before they are pregnant. And we also introduced the service, we call it birth planning. That also includes the men, and the men are the ones that have phones, which means if they can start using the service and supporting their wives, then maybe we can increase the accessibility of the facility, and that can benefit a lot of women.
It is a good idea, it's a good service, because most of them were being cancelled on the phone. Before then, they could have come to hospital with the minor complaints, but then with the Chipatala phone, they were having their counselling right there.
Chipatala Chapafoni has been helpful. When I call them, they advise me on whether I need to go to hospital or not. Because they are from the hospital, I trust them and take their advice.
Most women, they didn't come up to start their antenatal clinic at the right time. But just because of the Chipatala Chapafoni, women are now, they have knowledge to come here at the right time.
When a child is sick, it's great that the mother can call on the phone and not have to walk long distances. For my daughter and I, Chipatala Chapafoni has saved our lives. It's very useful and we should have had it long ago. Don't take the service away now.
What's really exciting about what's happening here in Malawi is that now we've shown what can work in this project. It's being taken up in 3 other districts. So over the next 2 years it will be expanded and we can look at where it can be taken up elsewhere in Malawi and in other countries.
Concern Worldwide here in Korakota is implementing a program called Reducing Maternal Mortality and Morbidity in Vulnerable Women. Korakota is one of the areas which have got a high maternal mortality ratio, and then at the moment we're trying to reduce that. And with regards to what we had seen with the previous innovations program and the piloting, we decided to actually scale up the project here in Korakota. And the Chipatala Chapafoni is going to be useful really in trying to get the women who are based in the hard-to-reach areas. So we're going to be adapting the whole project. We're still going to call it Chipatala Chapafoni, but with some changes therein. And we want to be adapting something with changes. So it's really beneficial that there was this pilot project.
We can say to anywhere in any country where their women and children suffer the same kinds of constraints and barriers in getting access to care, that this model can be used there too. We have research data that shows how it works best. We have descriptions of implementation that show how to take it forward. So this can be a part of improving access to care for women in difficult environments pretty much anywhere.